Okay, this is the limited version. I actually said the limited version on the long-term version. So the long-term version is on our website. It will be up shortly. But this is the substance abuse video 1A. And this is the shortened version. This is the shortened version to go on the Google website and YouTube. To view the LinkedIn version, it has a lot of statistics and facts. Please go there, www.ishearts.com. Please be a very active member and voice your opinions. And we're currently using a professionally created Google Plus webpage among many other sites. Please go to google.com. It's ishearts at mental health. ishearts MH. Introductory video, complex statistics connection between mental illness and substance abuse, 1A. I think there's going to be a 1B, 1C, and 1D. I'm not certain yet. I have to look at the statistics. I have to look at what's written out for me. Dual diagnosis treatment is a relatively new innovation in the field of addiction recovery. Until the 1990s, people who were experiencing symptoms on a mental health disorder, anxiety attacks, depressive episodes, delusional behavior, or mood swings were treated separately from those who sought help for drug or alcohol abuse. When these conditions overlapped, clients were often denied treatment for a mental health illness until they got clean and sober. Unfortunately, because substance abuse is often driven by an underlying psychiatric disorder, this meant that many people with a dual diagnosis of addiction and mental health disorder never got the help they needed. And I'm going to give you an example. Depressive episodes. You might drink because of depressive episodes. So it alters the anatomy of the brain, it alters the chemical functioning of the brain, and it can pursue through life, if not years. It can pursue through years, if not lifetime. Okay, too often addiction goes untreated. According to National Survey on Drug Use and Health, 23.2 million persons, 9.4% of the population aged 12 or older, needed treatment for an illicit drug or alcohol use problem in 2007. Of these individuals, 2.4 million, 10.4% of those who needed treatment. That means out of 23.2 million, 2.4 million needed treatment. Received treatment for a specialty facility, hospital, drug, or alcohol rehabilitation health center. Thus, 20.8 million persons, 8.4% of the population aged 12 or older, needed treatment for an illicit drug or alcohol use problem, but did not receive it. That means that 20.8 million persons needed treatment for illicit drug or alcohol. And we're talking about illicit drugs, not just prescriptions. So we're talking purely illicit drugs or alcohol. These estimates are similar to those in previous years. It is increasing at an alarming rate recently. This study was done in 2007, and in the recent times, it has gotten worse. Okay, more than 500,000 Americans with serious mental illness are falling through the cracks of a system in tatters. A U.S. Today special report shows that mentally ill who have nowhere to go find little sympathy for those around them, often land in emergency rooms, county jails, and city streets. The lucky ones find homes and family. The unlucky ones show up in the morgue. Not acceptable. The problem is, if you don't have a bone sticking out of you that shows utter pain, people look at you and do not understand the mental pain and substance abuse pain that you are in. That's the truth. And now look at this graph while I go on it. In the 1950s, about 500,000 people with serious mental illness were treated in publicly funded psychiatric hospitals today, with fewer hospital beds and inadequate community services. As estimated, 590,000 mentally ill patients a year end up in countries, mental health institutes, jails, prisons, city streets, homeless shelters, and the more due to society. Anyway, so beds available 108,000, homeless 200,000, jail and prison 356,000, suicide 34,000. That is unacceptable. 100,000 beds available, and we got 3 times as much in needing critical care. Each person represents 1,000. This is not acceptable by any means in America. A land that claims to be first, but is in reality is in last in so many fields, including mental health and healthcare. 20% of inmates have a mental illness. True, and that's been up on the rise. A variety of services such as supported housing, supported employment, and a comprehensive program called assertive community treatment are cost-effective ways to dramatically improve the lives of people with mental illness, says Marie Gilbert, a doctor and executive director of the National Alliance of Mental Health. Yet, fewer than 2% of adults with serious mental illness receive these services according to the Substance Abuse and Mental Health Services Administration. Fewer than 2% receive these services. That is inadequate. Drug addiction is a brain disease that affects behavior. Drug addiction has well-recognized cognitive, behavioral, and psychological characteristics and contribute to continued use of drugs despite the harmful consequences. Scientists have also found that chronic drug abuse alters the brain's anatomy and the chemistry, and that these changes can last for months or years after the individual has stopped using drugs. The transformation may help explain why addicted persons are at a high risk for relapse to drug abuse after long periods of abstinence, and why this persists in seeking drugs despite the consequences. The National Bureau of Economic Research, the NBER, reports that there is a definite connection between mental illness and the use of addictive substances, and that mental disorders patients are responsible for the consumption of 38% of alcohol, 44% of cocaine, and 44% of cigarettes. It gets worse. The NBER also reports that people who have diagnosed with a mental illness disorder at some point in their lives are responsible for the consumption of 69% of alcohol, 84% of cocaine, 68% of cigarettes. There's clearly a connection between substance abuse and mental disorders, and any number of these conditions can develop, each with its own set of causes and symptoms, as well as appropriate intervention and dual diagnosis methods. Dual diagnosis methods means just that you have substance abuse and mental health. It's really one thing, but this is just part of the video. The rest of the video is longer, but go see our site at www.ishearts.com and view the rest of the video. Thank you very much. Have a good day, good night, good mental health.